Welcome back to the Balanced HI podcast, where we pull back the curtains on healthcare, digital health, and the unsung heroes who makes this entire system actually works. Hi, I'm Samantha Lugine, your host, your guide, and definitely the only person you know who would say this out loud. Healthcare may run on stethoscopes and scallops, but it survives. It survives on pure, clean data. Let me say it again for the people in the back. The boring stuff nobody brags about on Grey's Anatomy is the reason the whole
hospital stays standing.
And today, we're talking about foundation, the Wi-Fi, the invisible oxygen of healthcare. Information management, or in short, HIM, if you're cool like that. So grab your coffee or your wine, depending on the day, drink responsibly. Put down the fax machine. Yes, some of you guys are still using faxing in 2025 like it's a plot episode of The Office. Let's get into it. And please let go of the fax, please. That manual thing. HIM is like Wi-Fi. You don't notice it when it's working, but when it's gone, everything stops. World stop. If you know, you know. And trust me, it's going to get spicy today. And we do get spicy in these episodes. Make sure you guys are awake and alert. Let's start simple. What is HIM? In plain English, HIM makes sure data is accurate, private, accessible, and useful. Doctors cannot treat without it. Hospitals cannot bill without it. Patients cannot trust without it. If HIM disappears tomorrow, healthcare would collapse like a bad plot twist on Succession. Think about it. Thinking. Who ensures your allergy to penicillin is present in your EMR? HIM. Or who codes your diagnosis so insurance companies stop playing these cat and mouse game? HIM. Who makes sure your chart doesn't randomly say you're pregnant when you are not? HIM. Who pulls the right record? I can't believe I'm thinking about that at 2 a.m. when you're in the ER. Trust me, we're not pulling records because we have an EMR or an EHR. But imagine like it's a scene from Snowfall where you're like, hello, I'm coming in to be seen. HIM just ensures that it's present. And a shout out to informatics. We don't do it all. HIM is not the only ones. So health information professions are like avengers of healthcare data. Except instead of capes, we have coding books and compliance binders. We're not carrying these coding books, by the way. We have coding tools that has the coding guidelines and all that information embedded into it. Thank God to technology. Okay, let's get back on track. Let's make this real. Imagine watching The Office. Love that show. but without editors, just raw, uncut, chaotic Michael Scott footage, 40 hours straight. That's healthcare without HIM. We're the editors. We make raw clinical data turn into a story the system understands, or a picture, or Google Maps. We are the Google Maps because without us, without a GPS, just imagine, doesn't know where you're going, doesn't know where you are, but suggesting a Starbucks 3 states away. Imagine that. That's healthcare without HIM. HIM is the Google Maps of healthcare. Without us, everybody is lost. And I'm not exaggerating. I'm not exaggerating. Come a little closer. Now let's talk accuracy. Because in healthcare, accuracy is not optional. No, it's not. If your chart says you're allergic to penicillin, but you are not, that is annoying. If your chart says you are not allergic to penicillin, but you are, that is catastrophic. Accuracy saves lives. Privacy protects trust. If patients cannot trust their information is safe, they will not share. And if they will not share, healthcare breaks down. Like the Matrix when the code glitches. HIM is the lock, the key, the vault, and the bouncer at the club. All of it. See, we're getting spicy. Got to make sure you guys are still awake with me. Without HIM, your data is like your ex's Netflix password, passed around to anyone who accesses. And Netflix is cracking down on us, so I hope they're not watching. I just gave it away. Let's talk to both sides of our audience, to the health, to my health information professionals. I had to clean that up there. You already know the audits, the documentation chases, the coding deadlines that feel like the season finale of Scandal, HIPAA training that makes you question your entire career. I'm glad you're still with us, by the way. But you also know the pride of catching the mistake that saves a patient, or fixing a record so that claims get paid. That's the work. That's the purpose. To the everyday listeners, surprise! You've probably interacted or encountered us with HIM every month of your life. Every patient portal login, HIM, and informatics, because they give you the access. Every time your record follows you to a new doctor, HIM, here we are releasing that data to you. Every time your bill isn't tripled, quadrupled charged, HIM. And sorry if it is charged multiple times, but thank God you are being vigilant and looking at your records as a empowered patient. Doctors save lives. HIM saves systems. HIM is invisible on purpose. Nobody sees it purposely. Nobody celebrates us. It's okay. But without it, healthcare flatlines. Beep. It's oxygen. You forget it's there until it's gone. HIM, again, is like oxygen. You do not notice it, but without it, nothing survives. I had to repeat that just to make sure you guys really get it, that it marinates, osmosis into your system. Not all of that, well, now all of that was a warm up, actually. Oh, yes, yes, it was a warm up. HIM is the Wi Fi of healthcare. AI, oh, that's a different story. AI is the entire smart home system built on top of it. And I love a smart system and I love a smart house. You should see my home. AI walked into healthcare like the new intern who claims they can optimize workflow, predict patients' trends, and revolutionize billing. That's a good one. But cannot even find the break room yet. Let's talk about that. Yep, we have to be honest. Yep, we may love AI, and we do love AI. But we have to be honest. AI is everywhere in the ER, in the pharmacy, in imaging, in billing, in portals, in apps, in your Apple Watch, which I have on today. The watch, or any smart watch, is acting like the billions wellness ring, tracks everything but your zodiac sign. I'm a Taurus, by the way. AI is in fraud detection. AI is in documentation prompts. AI is in clinical alerts. AI is in scheduling. AI is in denials protection. AI is the most helpful, terrifying, inconsistent assistant healthcare has ever had. Oh my God. I don't know. This just makes me laugh because it's so true. Sometimes AI feels like magic. Sometimes AI feels like a lie. Sometimes AI feels like the future. And it feels like Black Mirror, all at the same time. It depends on the day or the time of day or the week. Just depends. AI is not nibbling around the edges of HIM. It's taking a full seat on our table. At our table, AI can now summarize documentation and emails. I gotta be secret. That's my secret. These lengthy emails, they get a bit much. So I do use it to summarize my emails, as I was saying. Predicts diagnosis, suggests codes, flag errors, detect missing elements, audit records, accelerate indexing, analyze patterns, clean data, support privacy risk scans. But AI cannot do this. It cannot interpret nuances, understand context, read between the lines, comprehend medical necessity, manage payer rules, differentiate clinical truth from narrative fluff, logically sequence complex diagnoses, maintain integrity, ensure compliance, make ethical choices, avoid hallucinating. AI is brilliant, but is also the coworker who needs supervision at all times. This is why Digital Health Navigator exists. Selfish plug. This is why, another selfish plug, HIM Toolkit exists. Created by me. Matter. AI assisted coding is here. And listen, AI
Hello.
can be impressive.
This is
I'm
why
impressed.
HIM will
But AI
always
will
matter.
confidently assign a code for a procedure that never happened. I'm sorry to say. AI will invent diagnosis like it's writing fun fiction for Grey's Anatomy. AI will read mild distress as a acute life ending disaster. Coders are the truth checkers. Coders are the analysts. coders are the human in the human intelligence. AI can write a code, HIM understands the story. Here's where it gets serious. AI creates numerous data bias, hallucinations, misidentification, over collection, privacy violations, algorithm discrimination, security vulnerabilities. We're entering an era where compliance officers feel like Olivia Pope in Scandal. It's handled, but also internally. But Lord, please let the AI behave. Please. I'm cracking in my voice. AI requires policies, audits, governance, monitoring, ethic frameworks. HIM will be leading that charge, along with our compliance officer. And IT, can't forget them. Patients are using AI more than they realize. Their step tracker, AI. Their symptom tracker, AI. Their appointment reminder, AI. Their insurance estimate, AI. Their wearable device, again. Predicting stress levels like the billions. Health ring, AI. AI can empower patients, but it can also overwhelm them. Patients deserve AI that is helpful, not creepy, supportive, not surveillance, transparent, but not manipulative. AI should care for people, not watch them. AI in revenue cycle, it's giving double-edged sword. AI can speed claims. AI can predict denials. AI can correct logic. AI can even match clinical documentation. But it can also mass produce wrong claims at the speed of light. One hallucinated AI algorithm can cost a hospital millions and millions. AI must be watched, reviewed, definitely audited, supervised, protected. And who does that, or who can do that? Hello, did you hear about my superhero Avengers analogy? That's us. Dun, 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 dun. HIM professionals. Well, that's kind of an oxymoron. Health information professionals. HIM is not dying. The profession is not dying. The profession is not dying. HIM is transforming. Jobs will evolve from indexing to auditing coding to analyzing chart chasing to governance compliance to digital ethics, privacy to AI monitoring. The future HIM, the future health information profession, I keep doing that, is going to be tech savvy, data literate, AI literate, strategic, analysts, informed, powerful. AI needs HIM more than HIM needs AI. But sometimes I do feel like I need AI. I don't know. I have become dependent on AI in some aspects. If you are in the health information profession, here's what you need to know to master the field, the profession right now. Interoperability, number one and important. AI literacy, analytics, privacy law, algorithm risk, clinical documentation, very important. Coding at a high level, digital governance, workflow engineering, data storytelling, prompt engineering, automation tools, everything you need. Oh, guess what? It's in my digital health navigator book. another selfish plug there, or the HIM toolkit. HIM is stepping into its greatest era. I think it's a great time to be in this field. All right, fam. That's today's deep dive. You just spent roughly a half an hour with me unpacking HIM, AI, digital health, privacy, accuracy, revenue cycle, and the future of our profession. If you learned something, if you laughed, I hope I made you laugh. If you finally understand HIM, for those who say, I still do not know what you do, Samantha, I hope you watch this and I hope you understand. Okay, do 3 things. Share the episode, please. 2, hit the subscribe. And then 3, follow me everywhere. I'm on LinkedIn, Samantha Lugine, TikTok and IG, Balance the HI Podcast, YouTube Shorts, same name. And remember this, if you don't understand HIM, you don't understand healthcare. Again, with the drama, I know. This is the Balance HI Podcast. I'm Samantha Lugine. See you next week and stay balanced.
Hey, listen, before we wrap up, I need to talk about the secret elephant in the hospital hallways. Why people still do not use their damn patient portal. Yes, I said it. 1, portal phobia is real. You know what I've learned? Some folks treat the patient portal like it's a Bermuda Triangle. They swear if they log in, something is going to swallow their soul. The lab results, the medical bills, the message from their doctor they never answered. It's giving avoidant attachment style, but make it healthcare. We've created a whole generation of people who can track their Amazon package from China, but can't track their blood pressure results from last Wednesday. And don't get me started on the ones who finally logged in and they click one button, see a word they do not recognize, and scream, Samantha, I'm dying. No, that's just your sodium levels, and I can't help to chuckle. I'm sorry. 2, the portal isn't ugly. Your expectations are. A lot of people talk down on the portal like they're supposed to look like TikTok. No, this is healthcare. We're lucky if the button colors match. So true. But the portal is not supposed to be cute. It's supposed to be consistent, right? It's supposed to show you your story. What happened, what's happening, and what you need to know next. 3, stop letting your doctor office be your diary. Let me lovingly drag people for a second. Your doctor's office should not know more about your health than you do. This is not Bridgerton. You do not need a royal messenger delivering updates about your own body. Your portal keeps receipts, appointments, labs, imaging, and diagnosis. It's basically the notes app of your healthcare life. You ever try remembering something your doctor said and you get that blank stare? The same blank stare you had during the SATs? Yeah, you know that stare. Exactly. Use your portal. Use, period, your, period, portal. I feel like I had to say it that way. 4, PHR versus portal glow up. Your portal tells you what happened. Your PHR, your personal health record, tells you who you are. Portal equals your medical receipts. PHR equals your medical resume. When you put them together, oh, that's interoperability with seasoning. 5, for the health information professionals, listen. For my HIM family tuning in, you already know. A well-used patient portal saves time, reduce phone calls, eliminating printing because I'm allergic to paper, reduce short copy requests, and improve documentation integrity. Yes, your portal is an HIM issue. Anything that strengthens patient's engagement strengthens data quality. And anything that strengthens data quality strengthens billing. Yes, I said the quiet part out loud. You're welcome. Okay, so here's your homework. Log into your patient portal today, update your information, read your notes, track your results, message your care team if you have any questions. Because your health data is talking, and the patient portal is the only place where it tells you the truth. So again, stay informed, stay empowered, and stay balanced.